3, 2, 1. We are live.
Uh, Good evening, friends, and good evening, everyone. So I could see a mix of medico friends and non-medico friends, and so those who want to learn about prostate diseases. So good evening, everyone. So this is Dr. Gowrishankar. I am consultant urologist and andrologist working in Sendil Multi-Speciality Hospital, Erode. So, so what is this month all about? It's something called as National Prostate Awareness Month. So, why is it celebrated, or why we need to create awareness? So, first thing is, so I think before we go, I think just now I got the information that it has to be both in English and Tamil. So, we have a mixed set of audience here. So, important the slides will be in English, but the important aspects and the key features I'll probably repeat it in Tamil as well. So first, so a lot of people prostate diseases are one of the most common symptoms or diseases which at least it roughly about 30 to 40% of urologist practice. So but the thing is, like, most people don't know what is prostate or where is it located, and they don't know about the prostate diseases and stuff. So this awareness month is uh, it's been created just to give awareness about prostate, because prostate disease prostate diseases are much commoner than we think. For example, the early detection of prostate cancer gives a very good result and a successful outcome for the patient. And the second thing is, there are other common clinical conditions like inflammation of the prostate, which is called as the prostatitis. So we need to know a little bit. So it's probably early treatment and early detection can help the patient. And there is a prostate enlargement which can start after 40 or 45 years of age. So, and it and quality of life issue is the main thing in prostate diseases, because something like nocturia, getting up 3 to 4 times to urinate, can all impair your quality of life. So, and this can occur in this is a common diseases in men of all age group. For example, a younger age group will have inflammation, that is prostatitis, and middle age and older men will have either a benign enlargement of prostate that we'll be talking about, as well as cancer prostate, uh, which is going into the slides.
So click on screen and then press next.
Click on
Screen at anywhere.
enter, sir.
And please move next.
Yeah, got it. Okay, this talk is on prostate health. So first, so what are we going to see today is first just anatomy of the prostate, like where is it located, and what is the basic function of prostate. So why is prostate gland? What are the uses of prostate gland, and what are the common diseases of prostate, and the basic treatment for all these prostate diseases, and how can we prevent this prostate disease, and some take-home points, the very important take-home points, which at least like the basic things which like everyone should know about the prostate diseases. So, like most of you would have been aware, so this is the male urinary system. So what happens is, like, this is the complete male urinary system. So as you know, it starts from kidneys, so which drains urine into the ureters, and then it's urinary bladder, and then this is the urethra, which is the tube which transports urine from the bladder to the penis. So we have two kidneys, and most of you know the function of the kidneys. One, it helps in filtering the blood. So it filter blood to remove unwanted substances. Second is they also secrete waste into the urine. So basic function of the kidney. So what happens is from the kidneys, you see two long tubes running, which transports urine from the kidneys to the bladder. So bladder is the reservoir for urine. So you can see here, right? The bladder contains a smooth muscle called as detrusor muscle. So what happens is this detrusor muscle relaxes to hold urine and it contracts for urination. So these are the basic function of bladder. So and below the bladder you see is called as prostate. So it is present only for males. And I'll be telling you about the functions and the important diseases which can affect the prostate gland. Okay. So as I told you, we have two kidneys, then followed by two ureters, which drain, and then bladder, which is the reservoir, followed by prostate and urethra. So before going into this thing, before going into the diseases, this is prostate gland. So as I told you, prostate gland is located below the bladder in men. So this urethra, you can see that the urethra is the one in the center, which runs through the prostate. It runs from this bladder neck to the external urethral meatus is the external urethral meatus it runs. So what happens is this urethra is the tube that transports urine from the bladder out of the penis. So it passes through the center of the prostate. So what happens is, you can see here. So prostate is on the both the sides of the urethra. So the urethra passes center. So what happens is when this prostate enlarges, it blocks the urine flow. So that is the main cause of uh, obstruction in males. So first we need to know what is something called as this. I'll be using frequently. That is called as LUTS. This is urinary symptoms. So what are the symptoms patient can present to us? So what are the symptoms commonly patients will, the upper urinary tract means kidneys and ureters are called as the upper urinary tract, and bladder and urethra is called as the lower urinary tract. So today we're going to discuss about the prostate. So prostate comes in lower urinary tract. So that is bladder, the reservoir for the reservoir, as well as the urethra, which drains bladder from uh, which drains urine from bladder to out of the body. So, so first, the common symptoms are, there are two types of LUTS is called as the lower urinary tract symptoms. So the common urinary symptoms which patient can present to us, one is frequency, that is increased frequency of urination. And second is urgency. So urgency is relative inability to postpone urination. So I'm not able to postpone urination, I have the sudden urge to void. So that is called as the urgency. And third is nocturia. Nocturia is increased frequency of nocturnal urination. So urination in the night time, if it is more, it is called as nocturia. So these are the main storage symptoms. And what are the voiding symptoms? The symptoms during void. One is hesitancy. So what hesitancy exactly is? There is a patient will be experiencing a delay before able to start urination. So that is called as hesitancy. And poor stream is the reduced force of urinary stream is called as a poor stream. Intermittent flow or intermittency is stopping and starting of starting during urination. So it will be like a stop start kind of a thing during urination. And fourth is incomplete emptying, that feeling that bladder has not fully emptied. So that will be the main symptom, but that too in a neuro population and in a older individuals and in a diabetics, incomplete emptying is a very important symptom. So they'll classically tell us that the feeling that the bladder is not emptied. So this is one of the main men's health issue. So the common is urinary incontinence. What is incontinence means? Involuntary leakage of urine. So without a knowledge, urine leaks. That's a very common problem. In that is approximately over 10%. So anything over 10% is quite significant. So it is over 11% in men with age group of 60 to 65 years. And lower urinary tract symptoms, I told you, one third of men will develop urinary tract symptoms. So these are the certain things which we need to know. What are the red flags? What are the things we need to be cautious about and all that? So nocturia. So nocturia is present almost 70 in about 78% of older women. That's a very high number. So as I told you, so before going into the diseases, I told you these are all interlinked. So one is lower urinary tract symptoms. We need to know about the lower urinary tract symptoms and enlarged prostate. Prostate glands will start, the prostate gland symptoms or the gland will start enlarging after 40 to 45 years of age. So, and third is BO is called as the bladder outlet obstruction. So, bladder, these all three have a collective symptom. So, that is the main thing. So, you can see here, this is the first on the diagram on the left. This is the bladder, you can see. So, and this is the urethra, and on the sides, you can see prostate, which is below the bladder. So, this is a normal prostate gland where you see urethra is okay, but when the prostate gland enlarges, it compresses the urethra. So on the right side, this is a cystoscopy finding. Cystoscopy is the it's an endoscopic procedure whereby you can visualize urethra, prostate, and bladder. So the top the image which shows obstructed bladder, and the lower one is the normal. You can see uh, the urethra is completely all right here, and where in this image the enlarged prostate is obstructing the outflow. So that is causing a outflow obstruction because of prostate enlargement, which will start from the age of 40 to 45 years, will go on till lifetime. So that is the main thing. So as I told you before, prostate is a small walnut-shaped gland in men that produces seminal fluid that nourishes and transports sperm. So as I told you, you can see prostate. This is the bladder, which is normal bladder. This is the prostate, where it is not enlarged. Once it enlarges, you can see it is obstructing the outflow. So which is causing symptoms. So this is located just below the bladder in men. So urethra is the tube. You can see this is the urethra, which transports urine from the bladder out of the penis. And this urethra passes through the center of prostate. When prostate enlarges, it obstructs your urine flow. So, on the what is the important function of prostate? So, the common people ask me is this prostate helps they secrete alkaline fluid, so which helps in providing lubrication and nutrition for the sperms. So, it is an alkaline fluid because so this is this mainly helps for the lubrication and as well as the nutrition for the sperms, and it provides the alkaline medium which is necessary. And so what are the diseases of prostate? As I told you, the three most common diseases are: first is inflammation, which is called as the prostatitis, and enlargement, that is as as men get older, they'll have prostatic enlargement. That depends on a lot of factors which we'll be seeing in the later slides. And third is cancer prostate. Prostate cancer is one of the common cancers. Uh, it's one of the very common cancer, mainly in African population. And after that, followed by Western population, and Asian population is comparatively less. So this is called as IPSS score. So International Prostate Symptom Score. This will be available in all the regional languages. So this is in English. So this broadly gives an idea of the symptoms. Like for example, there are you can see that there are 7 which we have discussed. No, incomplete emptying, frequency, weak stream, urgency, and all that. And there is a last thing. It's called as quality of life. So the quality of life is it's a very important thing. When you see the Western population, for them, getting up once in the night itself is a quality of life issue. Maybe for some people here, getting up 2 to 3 times in the night is okay. So quality of life depends on patient to patient, and so that is one thing important. And this IPSS score. So we need to. So usually, what happens is in my OPD, so my staff before patient meets me, so they just have to fill this form. So by the time we can assess, so the same thing. So with the scoring system, we'll be able to know whether the patient is in whether the patient is in mild, moderate, or severe. So accordingly, we can, after the examination, we can guide the treatment. So this is available in, probably you can just download it from Google. It's called IPSS score. So this is very helpful to know us, we where we are placed. Like for example, we have mild symptoms or moderate symptoms or severe symptoms. Accordingly, we can give treatment. So the common condition. So when men get older, this is the prostate gland enlargement. It can happen like so it can start from 40 years, from certain people 45 years, and till his lifetime it will be. For example, as I told you, an enlarged prostate can cause uncomfortable urinary symptoms such as blocking the flow of urine out of the bladder. It can also cause, like, over a period of time, the patient is not really getting treated or is causing a lot of problems. It can cause bladder problem, any problem in the urinary tract, or it can even affect your kidneys. So what are the signs and symptoms of prostatic enlargement? This is most common after the age of 50 years. So first is frequent or urgent need to urinate. And second is increased frequency of urination at night. As I told you, it's called nocturia. Third is difficulty in starting urination. Sir, I'm not able to start urination. So I need to spend at least 5 to 10 minutes in the toilet. So that will be the most common symptoms of patient. So and the fourth is a weak urine stream. So that will be then, and dribbling at the end of urine. And the important thing is that inability to completely empty the bladder will be the sixth symptom. So as I told you, most men will have continued prostate growth throughout the life. So which enlarges the prostate enough to cause the urinary symptoms, and it significantly block urine flow. So what are the risk factors? So one is uh, aging. So gland starts enlarging after the age of 40 years, and men, at least one third of men will experience mild to moderate, or moderate to severe symptoms by the age of 60 years, and half of the patient by the age of 80 years. So family history: if father or brother with prostate problems, so you're more likely to have problems as well. And diabetes and heart diseases might increase the risk of benign prostatic hyperplasia. So lifestyle, as always, most with lower urinary tract diseases or with prostate diseases, obesity plays a key role. So obesity increases the risk of BPH, while exercise can lower the risk. So what are the complications? If the prostate gland completely obstructs the outflow, patient can go for retention. So retention in the sense is acute retention, in the patient will not be able to avoid urine. The second is urinary tract infection. I told you, incomplete emptying. So incomplete emptying, more so in older men, in diabetics, or any other immunocompromised, or a patient with a neurologic condition, they are more prone for urinary tract infections. And next common is, because of the urinary stasis, bladder stones can occur, and bladder damage, and long-term and recurrent infections can cause kidney damage as well. So the treatment depends on size of your prostate, your age, your overall health, and the discomfort or bother you are experiencing. So treatment is not based on one factor. It's not like uh, you go to a treatment of, you go to a doctor, for all patients, it's not the, so we need to take in consideration of all these aspects and then probably suggest one. So as I told you, prostate, we have the newer form of drugs are excellent with much lesser complication. So most people, at least 50 to 60% of the people, can get uh, can have a better quality of life with medical management. So medical management commonly we use, depends on the prostate size. If the prostate size is lesser, we'll just we'll just start a medication just to improve your urine outflow. And the prostate size is uh, if the prostate size is more than 40 cc, we might have to add a drug to reduce the size of your prostate growth. So, and the next thing is, if there are indications, if the patient doesn't respond to medical therapy, or the size of the prostate is too big, or the quality of life issues are there, and there are other complications of benign prostatic hyperplasia, like the patient has uh, stone, and there are other problems of severe obstruction. So then we might have to go for a minimal invasive or a surgical therapy. The commonly performed procedure is called as TURP, transurethral resection of prostate. It's an endoscopic procedure to resect the prostate gland. So that is a common procedure, and you do have laser procedures as well. So what are the complex symptoms? So one is hematuria. Hematuria is blood in the urine. So that is really a complex problem. And recurrent urinary tract infection can cause major issues. Third, I told you retention. A complete obstruction can cause acute or a chronic retention. So fourth is incontinence. Involuntary loss of urine is these four can cause complex symptoms. So I told you prostatitis. Prostatitis is more common in younger men. So prostatitis is the inflammation of the prostate gland. So prostatitis often causes painful or difficult urination. And third thing, it can cause pain in the groin or pelvic area or genitals. It can, as I told you, it's more common in younger men, and some type of prostatitis lasts for months. That is called as chronic prostatitis. So as I told you, pain and burning sensation while urinating, that is dysuria, difficulty in urinating, frequent urination with uh, most likely nocturia, and urgent need to urinate will be the common symptoms of patients presenting with prostatitis. So what are the risk factors of prostatitis? As I told you, having had prostatitis previously is one of the risk factor. It can recur, and infection in the bladder or in the urethra. Urethra, as I told you, that's the tube which transports urine and semen to the penis. So having pelvic trauma, such as injury from either bicycling or horseback riding, can cause prostatitis. A urinary catheter for a shorter duration in some, and for longer duration with comorbidities, can also cause prostatitis. And people with HIV and AIDS are more prone to develop prostatitis, and a patient with a recent history of prostate biopsy can get prostatitis. So complication of prostatitis, it can cause bacterial infection of the blood, and it can cause inflammation of the epididymis, and it can also cause abscess. Abscess is a pus-filled cavity in the prostate, which requires immediate treatment. There, they are known to cause semen abnormalities and infertility. Uh, with regards to prostatitis and prostate cancer, there are no direct evidences. So it does not play a major role in causing a prostate cancer, but with infertility, it definitely has a role. So common topic, what is prostate cancer? This is the most common type of cancer in men. So usually prostate cancer grows slowly and initially confined to prostate gland, where it may not cause serious harm. Luckily for Asian population, it is usually confined, and for us, it is most people, at least 60 to 70%, will have a early stage disease. The one thing is it's not aggressive like other cancer. At least most people will have prostate cancer which grows slowly and may need minimal or no treatment. Whereas in some other types of aggressive cancers can spread quickly. So the advantage with this cancer is if it is detected early, you have got a better chance of successful treatment. So what are the risk factors of prostate cancer? As I told you, the risk of prostate cancer increases as you age. At race, for reasons not yet determined, black men carry a great risk of prostate cancer, and in black men, this disease is more aggressive or advanced. Family history. This the For example, if men in your family have had a history of prostate cancer, or you have family history of genes that increase the risk of breast cancer, or a strong family history of breast cancer, uh, that is one important risk factor for developing a prostate cancer. And obesity plays a major role in all prostate diseases. So as I told you, obese men diagnosed with prostate cancer more likely will have a advanced disease. So screening of prostate. So screening of prostate is controversial. So there are certain institutes which advocate to test healthy men with no symptoms, whereas in certain countries or certain organizations it is controversial. So some recommend men consider prostate cancer screening in the 50s or sooner for men who have risk factors for prostate cancer. So this is, as I told you, individualized. So suppose if it's more common in African men and Western population, it is more common compared to Asian population. So this has to be discussed with this particular situation. Benefits and risk of the screening has to be discussed with doctor, and then accordingly we can do prostate cancer screening. So, but usually patients with symptoms or patients, as I told you, in the higher risk category or with family history of prostate cancer, screening can be started at the earliest. So prostate screening tests include digital rectal examination. It's called as DRE. It is a routine examination of your prostate. And second is it's a blood test which is called as the PSA. It is a prostate specific antigen. So both these tests has to be done. One is the examination, the another one is a prostate specific antigen, which is a blood test. Both together has a high chance of uh, identifying prostate disease, more likely malignancy. So, as I told you, DRE and PSA detects if it detects an abnormality. The other treatment or before that, the other investigation has to be individualized. For example, certain people might need an ultrasound that is called as transrectal ultrasound, where a small probe is inserted into your rectum, and biopsy. So prostate biopsy is like if PSA and digital rectal examination is suggestive of prostate cancer, prostate biopsy is the diagnostic test to diagnose prostate. It has a score called as, so it's a outpatient procedure. Uh, After this in this biopsy, you'll come to know whether you have prostate cancer or not, and what is the score. Something called as a Gleason score. So whereby you can grade the disease, uh, low risk or medium risk or higher risk categories. And the advanced investigation for prostate cancer is MRI with transrectal ultrasound fusion. That is the common advanced test. And if there is suggestive of bone metastasis, or then you can the doctor might ask you for a bone scan. And the other investigations are CT scan and PET scan. So PET scan to detect the spread. So, as I told you, whether to determine whether the prostate cancer is aggressive or not, there are uh, risk criteria. One is low risk, depends on your PSA. As I told you, biopsy will tell you the Gleason score, and Accordingly, we can differentiate low risk, intermediate, or high risk. So less than 10 PSA with Gleason score less than 7 is low risk. PSA 10 to 20 and Gleason more than 7 is intermediate risk. High risk is more than 20 with Gleason score more than 7 with a clinical staging is called as higher risk. So these are the other examination. As I told you, a distal rectal examination. Doctor inserts a finger into your rectum to check for your prostate for enlargement. Urine test to look for microscopic hematuria, which is the blood in the urine. Blood test, serum creatinine is routinely asked. This result can indicate kidney problems. There are other tests called prostate specific antigen, which we saw. This urinary flow test, it's called as a uroflow. And as I told you, post-void residual examination. So what are the treatment options for prostate cancer? So once the patient is categorized low risk, medium risk, or high risk, the treatment option will be discussed with the patients and attenders. There are various treatment options. For example, uh, as I told you, it's not for most people, it's not a very aggressive disease. So the options have been listed out. So one is a waitful watching. For example, if the patient is a older patient with life expectancy of less than 10 years, is very old with comorbidities, watchful waiting is one option. And active surveillance is followed for patients with mild disease. And the common surgery which is done for cancer prostate is called as a radical prostatectomy. It can be done via open surgery, it can be done via laparoscopy, and most advanced would be a robotic radical prostatectomy. And the other options are radiotherapy, chemotherapy, and androgen deprivation therapy. So what are the so now we will be talking about home remedies. What are the lifestyle modification or home remedies which we can follow to minimize the prostate diseases like prostate enlargement or to improve the quality of life in case of prostate diseases or to reduce the risk of prostate cancer and prostatitis. So first is choosing a healthy diet full of fruits and vegetables. Avoiding high fat food and red meat will definitely reduce the incidence. Uh, Choosing healthy food over the artificial supplements and exercise most days of the week and maintain a healthy weight will definitely reduce the incidence. And talk to your doctor about the increased risk of prostate cancer, whether if you have any family history or if you are in the higher risk category, you can always discuss with your doctor and go for serum PSA as well as a distal rectal examination. So, what are the lifestyle and home remedies for prostatitis? Prostatitis is, as I told you, the inflammation of the prostate is very common in younger men between the age of 35 and 50. So, soak in warm bath or sitz bath will help. Limiting or avoiding alcohol, caffeine, and spicy and acidic foods which can irritate the bladder. The common the problem with the sedentary lifestyle is the all these avoid activities of prolonged sitting or bicycling. Sitting for a long time is those patients are prone for prostatitis. You need to drink plenty of caffeine-free beverages. This will cause you to urinate more, which will help flush bacteria from your bladder. So these are the basic remedies for prostatitis. So what are the home remedies for prostate enlargement? Prostate enlargement, as I told you, it's common for people over the age of 45 or 50 years. To help control the symptoms of an enlarged prostate, first, try to limit the beverages in the evening. So cut down cut down all kinds of beverages in the evening. So limit your caffeine and alcohol since caffeine is also a bladder irritant. So it will cause increase in frequency of urination as well as it can cause urgency as well. So there are some medications like antihistamines need to be limited. And when you feel the first urge, uh, you need to avoid. And there has to be schedule the bathroom visit. Like for example, once in 3 hours or once in 4 hours. you need to empty your bladder. So for certain patients of overactivity or with prostate, this can help, and you need to follow a healthy diet, as I told you. Certain diets can help, like avoiding a bladder irritants. I'll talk to you about bladder irritants in the next slide. And staying active, as like the people with obese are more likely to have some certain problems. And as you know, cold climate can increase the prostatic symptoms, and keeping warm, so which will reduce the symptoms as well. So food and beverages might irritate your bladder. So the patients who are complaining of overactive bladder, I told you, right? Storage symptoms are more, and voiding symptoms. So main bladder irritants of coffee, tea, and carbonated drinks. So limit all these. And alcohol again can irritate your bladder. And there are acidic fruits like oranges, grapefruits, and lemon can irritate. And too much of spicy food is not that good. And tomato-based products and carbonated drinks and chocolates. So these have to be limited. If the patient complains of frequency, urgency, and more of storage symptoms like urgency and all, you need to reduce these foods and beverages. So before just I started this talk, I was like, from the organizers, they said like commonly we get two questions there. So if patients have enlarged prostate or BPH, do they experience sexual problems? Yes, uh, prostate enlargement, that is the benign prostatic hyperplasia, patient might experience sexual problems, but there are treatments which can help both. So there are treatments and newer drugs which uh, improves both lower urinary tract symptoms as well as erection in men. So there have been studies which have shown there is a connection between the prostatic hyperplasia as well as erectile dysfunction. And the other common question is sitting for a long periods. For example, IT professionals, and nowadays prostatitis is very common among IT. The one reason is when you sit for long periods, it puts pressure on your prostate gland and inflames it over time. So that is the main reason. And second is try to avoid long bike rides and sitting down for too long. So that can definitely reduce the incidence of prostatitis. So what are the red flags when you have to be alert? So when you should visit a urologist, or you should never postpone. Like for example, consider prostate cancer if there is a abnormal distal rectal examination or elevated PSA. Now certain labs are as a routine mast health checkup, they have PSA in all their packages. So if there is elevated PSA or abnormal DRE, first thing should come into mind is prostate cancer. Consider bladder cancer if a patient who's a smoker with urgency, frequency, or blood in the urine. We call it as painless hematuria. So, unless proved otherwise, painless hematuria, first diagnosis would be bladder cancer. So, if you see any smoker, or if a patient is a smoker with urgency, frequency, and blood in the urine, he needs to get worked up. So, most common diagnosis, or the first differential diagnosis, would be a bladder cancer. So red flag, as I told you, post-void residual urine is one of the important symptoms patient can present to you with. So what is the significant post-void residual urine? So post-void, the patient can complain of incomplete emptying. So that is the residual urine which is staying inside the bladder after urination. So ideal would be less than 10% of the voided volume is the normal. For example, the bladder, the normal capacity of the bladder varies from 350 ml to 550 ml. For certain people, it's around 400 to 600 ml. So 10%, more than 10% of residual urine is significant. So for example, post-void residual volume, like for non-mobile elderly patient, people with neurologic disease or suggestive of outflow obstruction, feeling of incomplete emptying more than 200 ml is definitely significant. And large post-void residues more than 400 ml staying in the bladder may be associated with increased risk of renal insufficiency. So ideal would be 10% of your voided volume is the normal. Less than that is the normal. So more than that, till 200 ml is without comorbidities is absolutely okay. But large, like very large post-void residual urine can, over a period of time, can affect your kidneys as well. So you need to be aware. So take home message. First thing I want to tell you is like prostate health is most common symptom of men over 40 years. So that is the first thing. And IPS, as I told you, prostate symptom score. So IPS is, you can download it. You can grade your symptoms like mild, moderate, or severe. So as I told you, blood in the urine for a smoker, first diagnosis, they have to be cautious and they have to be treated early. And post-void residual urine is one of the important findings we should be. And the awareness about prostate diseases is very important. One, to prevent kidney diseases. And second, earlier we start, medical management is more effective. You might not require a surgical treatment. And third is early detection. So both early detection of prostate cancer, uh, there are successful and definitive therapies can be given to the patient, and early detection always gives you higher chance of survival, and recovery is very, very good. So as I told you, storage symptoms and voiding symptoms, 67% of the men experience both storage and voiding symptoms. As I told you, bladder and prostate. Prostate is just below the bladder. So both the symptoms of bladder and prostate are common, and 67% of men can experience both these symptoms together. So that is one thing we need to know. And other possible causes of urinary symptoms. One, as I told you, urinary tract infection, like high residual urine can cause urinary tract infection. And we have discussed about prostatitis, which is the inflammation of the prostate, and stricture is the narrowing of the urethra. And bladder or kidney stones. Bladder stone can obstruct and can cause urinary symptoms as well. And there is a condition called as neurogenic bladder. The nerves that control the bladder can get affected, and patient can have urinary symptoms. And the cancers of prostate as well as bladder can cause urinary symptoms. So thank you again for your patient listening. I'm extremely happy to deliver this talk on this National Prostate Awareness Campaign. I thank Dr. Reddy's laboratory for this wonderful opportunity. Probably the questions I would be answering at a later time. So that's it from me now. Thank you so much.
Sir, thank you for the wonderful. Thank you so much. Wonderful. Yes, sir. Thanks, sir. It's been
Okay.